So we will continue from the part where we had stopped about the penicillins. The semi-synthetic penicillins are the next category. Now, although initially benzyl penicillin is the molecule that was developed, it had certain disadvantages that it will get inactivated by gastric acid. So when somebody takes it orally, it will get degraded. Secondly, there can be inactivation by the penicillinase enzyme, which is produced by certain microorganisms. So that penicillinase enzyme is also called as beta-lactamase enzyme. So if the organisms are producing this enzyme, then they will destroy the penicillin, and because of that, the penicillin will not act against those organisms. So we can say that those organisms have developed resistance to this penicillin. Then benzyl penicillin also has the disadvantage that it is having narrow spectrum of activity. So it will not act on a wide range of organisms. It has short duration of action, and many people were developing anaphylactic reaction, anaphylactic shock after being administered this drug. So in order to overcome these disadvantages, later the scientists developed newer penicillin molecules which are semi-synthetic in nature. So when we say semi-synthetic, semi means partly or half, and synthetic. So some part of that molecule, the 6-amino penicillinic acid nucleus, is developed by the uh, fungal organisms, and then we extract that molecule, that nucleus, and to that we attach different side chains to prepare different kinds of penicillins. So by this method, semi-synthetic penicillins are synthesized. Now, the classification of these semi-synthetic penicillins, we have different categories. The first category are the acid-resistant penicillins. Second category are the penicillinase-resistant penicillins. Then we have broad-spectrum penicillins. Okay. So like this, there are different kinds of categories under the semi-synthetic penicillins. So the first category, that is the acid-resistant penicillins, the example is a compound called as penicillin V. The full name of that is potassium phenoxymethyl penicillin. Now, this is similar to benzyl penicillin in its action, but it has the advantage that it will not be inactivated by the acid in the stomach. So that is why it is called as acid-resistant penicillin. Another advantage with this drug is that even if somebody is having food in the stomach, then that presence of the food will not interfere with the absorption of this drug. So it is having a good property. Now, the next category are the penicillin type which are resistant to the penicillinase enzyme. So, methicillin, cloxacillin, dicloxacillin, and nafcillin. All these are penicillinase resistant penicillins. So, what they have the property is that they will not get destroyed if it is given to the patient, and the organisms which are there in that patient, they start producing penicillinase enzyme, then these drugs will not get degraded by that penicillinase enzyme. Then the third category, the broad spectrum penicillins. So when we say broad spectrum, it means it will act on a wide range of organisms, which includes the gram positive organisms as well as the gram negative organisms. So this category contains different molecules like ampicillin, talampicillin, amoxicillin, right? These are the common ones. So ampicillin is having efficacy against gram-negative bacteria also, and it can be given orally, but it has some adverse reactions like skin rashes and all. So it is not generally used very often now because there are better molecules available. Amoxicillin is having better safety and it is used commonly nowadays. You may have seen some combination drugs where amoxicillin is given, right? Then we have what are called as extended spectrum penicillins or ESP. So compounds like carboxypenicillins, uridopenicillins, and amidinopenicillins. So if we want the penicillin to be effective against the gram-negative kind of infections, then we use these extended spectrum penicillins. So these extended spectrum penicillin are very effective against organisms called as pseudomonas. And if you combine them with aminoglycoside antibiotics, they have a synergistic action. Now, the thing is that if it is combined with the aminoglycoside antibiotic in the bottle itself, then it will get inactivated. But if you give them separately, then they have a synergistic action. So carbenicillin is one example. Then ticarcillin is another example. Piperacillin is also another example. And mesalinam. All these are different kinds of extended spectrum penicillins. Then there is, as I said, you may have noticed that many times there is a combination of amoxicillin given with clavulanic acid. Now what happens is that amoxicillin is a very good antibiotic, no doubt, but it is likely to get damaged by the penicillinase enzyme. So for that reason, to prevent that degradation, the amoxicillin can be combined with clavulanic acid. Now, this clavulanic acid is a compound which is produced by an organism called Streptomyces clavuligerus. Now, this enzyme, this clavulanic acid, will inhibit the penicillinase enzyme, and because of that, it will avoid the inactivation of the main penicillin molecule. So that is why it is combined together and given. So sometimes another inhibitor of the enzyme is there called sulbactam. That also can be combined with ampicillin and the combination can be used. So this is about the penicillins. Then we have the next category of compounds that we have to go to. Yeah, which is the macrolide antibiotics. So there are another group of antibiotics called as macrolide antibiotics, and the special feature of these is that they contain a large lactone ring in the structure. And the most important antibiotic out of this group is called as erythromycin. So this erythromycin is effective against different kinds of gram-positive cocci and some other strains like Haemophilus influenzae and diphtheria also. The mechanism of action is that it is bacteriostatic in low concentration and bactericidal in high concentration. So the mechanism of action of this erythromycin is that it is bacteriostatic in low concentration and bactericidal in high concentration. What it will do is it will inhibit the synthesis of proteins by the bacterial ribosomes. That is its mechanism of action. However, they do have some side effects like nausea, vomiting, epigastric pain, or in some people it will lead to allergic reactions like fever, urticaria, and dermatitis. Then there can also be hepatic dysfunction, some hepatitis the person may develop, or jaundice. And this erythromycin can be given as tablets. It can also be given in the form of injection for either intramuscular or intravenous use. What are the uses of this erythromycin? It is generally used in patients who have developed allergy to penicillin. It can be given if the person also develops resistance to penicillin. It can be used for treatment of diphtheria, and it is used as a prophylactic against rheumatic fever. So although it is having all these uses, but it also has these kind of adverse reactions. So that is the reason why there are some newer macrolide molecules which have been developed. So the disadvantages of erythromycin are that it is having narrow spectrum of activity, it causes gastric irritation, it is not able to penetrate the tissue very well, and it has a short half-life. That means it will get degraded very fast. So to overcome all these problems, newer macrolide drugs have been synthesized, and they include compounds like roxithromycin, clarithromycin, and azithromycin. You may have heard these names; they are very common, right? So anywhere, anytime anybody has a throat infection, upper respiratory tract infection, then we make use of these molecules. Okay. Um, then there are some miscellaneous antibiotics like lincomycin. This lincomycin is mainly bacteriostatic in its action. It will act by inhibiting the protein synthesis by the bacterial ribosomes. Again, this is used like erythromycin. It can be used in people who are resistant to penicillin, and also to erythromycin. Then we can use lincomycin. Or somebody who has allergy to penicillin and erythromycin, we can use lincomycin. And to treat acute and chronic osteomyelitis, we make use of lincomycin. It does have some side effects: nausea, vomiting, diarrhea, dizziness, headache. In some people, it can cause jaundice, or they can have pruritus or vaginitis. All these conditions may be there. Vancomycin is another antibiotic. It is obtained from the fungus called Streptomyces orientalis. Now, this is bactericidal, and it will inhibit the synthesis of the cell wall, and it cannot be having any action. It is ineffective orally, so it has to be given by intravenous injection. If you try to give intramuscularly, it will cause pain, so it has to be given by IV injection. Then fusidin is also another antibiotic. This compound has a steroidal structure, but it does not have any hormone-like action. It has synergistic action with penicillin and erythromycin. It can be used in combination with those. It does have some side effects like GI disturbance and local irritation. Bacitracin is another antibiotic. It has thiazolidine ring, and it also acts by inhibiting the synthesis of the cell wall. Now, this bacitracin is useful because the organisms cannot develop resistance to this antibiotic. So, it is useful in that way. But because it is a polypeptide in nature, it cannot be given orally because it will get degraded by the enzymes in the stomach. So, it has to be given by intramuscular injection. And either it has to be given intramuscular injection, or it can be used topically to dress the wounds, or as an intestinal antiseptic. Then we come to the other category of antibiotics called as the aminoglycoside antibiotics. Now, so far, whatever antibiotics we saw, they were acting mainly against the gram-positive organisms. Now, these aminoglycoside and the further antibiotics we are going to see are the ones which are going to be effective against gram-negative organisms. So, aminoglycoside antibiotics, they are called by this name because they have amino sugar and the glycosidic bond. So compounds in this category are streptomycin, kanamycin, gentamicin, amikacin, neomycin, fremicetin, and paromycin. So all these antibiotics are effective against gram-negative bacteria. But the thing is that although they are effective against the gram-negative bacteria, they have some toxic effects. All these antibiotics have the same toxic effects, that they can cause ototoxicity. Ototoxicity is a toxic effect, adverse reactions on the ear. Then they have nephrotoxicity. They will cause some kind of kidney damage. And thirdly, they can cause neuromuscular blockade. That means they will not allow the muscular function, the transmission of nerve impulse across the skeletal muscle, that neuromuscular junction will not be proper. So there will be some amount of difficulty in muscle movement. So streptomycin is generally preferred for treating tuberculosis. Kanamycin can be used, and it is also used against tuberculosis, also to treat infections by salmonella and shigella, which result in certain types of gastroenteritis or diarrhea and such conditions. Then it can also be used to treat infection of the urinary tract and respiratory tract. Amikacin is similar to kanamycin, and it is very effective against the infections caused by Pseudomonas organisms. Now, gentamicin is bactericidal antibiotic. It is not much absorbed when you give it orally, so it is given intramuscularly. Okay? And it is used as intestinal antiseptic. It can also be used topically whenever somebody has some skin infection. Gentamicin can be used. But if it is used on the skin, it can cause some side effects like skin reactions and photosensitizations. If it is given if it is given parenterally, it can cause renal damage also. Then neomycin is also used against gram-negative organisms. It is bactericidal, and it is not very well absorbed if it is given from the oral route. That is why if somebody is having infection in the intestine, it is very effective to give neomycin because it is not going to get absorbed. So it will stay in the intestine and exert the antibacterial action. Again, it has side effects like ototoxicity and nephrotoxicity. It is used for topical administration on the skin, for the eyes. It is used as intestinal antiseptic, And if gastroenteritis is caused due to E. coli organisms, we can make use of neomycin. Then pramycin. This is similar to neomycin. It is used again locally on the skin or for treating gastrointestinal infection. Paromycin is similar to that neomycin, and it also can be used for treatment of intestinal infection, like when somebody has chronic amoebic dysentery, we can use it. Or if you have someone has a problem where there are unnecessary bacteria growing in the bowels, then to sterilize that bowels, we can use paromycin. Then there are miscellaneous antibiotics. So these include compounds like colistin, polymyxin B, cycloserine. So all these, out of these, polymyxin B and cycloserine are commonly used. Okay. So this is about the macrolide antibiotics we have seen, and then about the aminoglycoside antibiotics. We'll continue in the next session.